It is my honor to be present to you all here in the topic of the early detection and diagnostic, and also the early intervention of autistic spectrum disorder. And the first of all, I will begin with a very short video that make me understanding about the autism brain. I found this video when I was training the residency, like many years ago, like 15 years ago. Okay, I will start this video.
For example, when a healthy person sees a face, it activates an area of the brain called the fusiform gyrus. In some autistic people, the inferotemporal gyrus is activated instead. This area is normally used in recognizing objects. This difference could explain the lack of attention autistic people pay to faces, even those of loved ones. Likewise, when a healthy person identifies a face's emotional expression, the amygdalae are normally activated. But in the same situation, the amygdalae of autistic persons are not activated. Different utilization of other areas in the brain might explain some autistic people's inability to recognize emotional expression. Studies have also shown that the production of the neurotransmitter serotonin is deficient in the frontal cortex of some autistic people. This deficiency could explain their repetitive movements. Such research provides many pathways to elucidate the various causes of autism. Unfortunately, they remain discrete.
From this video, we will know that why the autism lack attention in the people's face, or they not recognize other emotional expression. And also they have a repetitive behavior, movement. And to the question, why we need to screen very early detection in autism? Because of throughout of the world, because of the high prevalence, maybe in some country, maybe 1 per 68 children, and because of there are no pathognomonic signs or laboratories or biological markers to detect the ASD, and the early diagnosis is lead to early intervention, and the early intervention in result in the better prognosis and rising the IQ level of autism. So I will show you some of the early signs of autism. Right now, the concern about the early signs and behaviors of the children, especially in the first 1 year. And right now, they have the red flag for ASD from 12 months to 24 months. For example, symptoms in the first years of life, like no babbling, no pointing, not showing the object to caregiver, or lack of other gesture, lack of shared enjoyment, repetitive action or movement, and also poor eye contact, or not follow adult pointer finger. Paying more attention to objects than people, or limit play with toys, not copying action or sounds, and not responding to his or her name when called. And for 16 months, if children no spoken any word, or 24 months, there are no 2 words, meaningful phrases, or without prompt or repeat, or any loss of any speech, babbling, or social skill at any age. This is throughout the world, the awareness about the red flag. And I will focusing on more earlier than that is mean the infant. This slide is from the study from UC Davis from my institute in the state. They have 5 very early signs of infant. The first one is unusual visual fixation. Sometimes it will persistent examination of object. The second one is abnormal repetitive behavior, such as sometimes they're looking at their hands, playing with their hand, and rolling some object repetitive. The third one is lack of age-appropriate sound development. The fourth is delay intention communication, no effort to present any gesture or not gain parents' attention. The fifth one is decreased interest in interaction. They're more interested in object more than people. And about the research that very interesting right now. There's several research studying conduct in the infant that consider high risk and is based on having the older sibling with autism. And I will show you the 3 resources that's very interesting. The first one is about the head lag size, the second one is eye tracking size, and the third one is about the brain scan in infancy. And I will have every short present in video. This about the head lag size. And this research from Kennedy Krieger Institute from the state, and they found during pull to sit tests, we will see some head lag size.
Benjamin's 6 months old. I'm going to do the head lag test. Watch his head as I pull his arms up. It comes right up with his body. That's normal for his age.
I want you to pull yourself up.
But this is head lag.
Here we go.
And today, the startling news. At 6 months, it could be the earliest possible sign of autism. That's Ben Chasen in research video. Look again. See how his head stays back? Pediatricians have known head lag like this can be a sign of developmental delays. But today's study is the first to connect it to autism.
When we saw this video, for most pediatricians, we know about this sign for the delayed gross motor or in the sign in cerebral palsy. But right now, they're finding something that relates about delayed gross motor and autism, and also the social communication delay. This is a statistic that 90% of the subject was diagnosed with autism has an exhibit head lag in infants, and 54% that meet criteria of social communication delay will find this head lag sign too. And this sign is very simple and easy for parents to try to test this, but they talk about don't panic about this sign because just some normal kid can have transient head lag, but it will back to the normal like the typical child. The next research is about the eye tracking signs of autism in babies. This research team from the Emory University, they observe about the eye tracking in infants while watching the video that have people face movement. I show you this video.
In this darkened test room, Lucy Kane is watching videos. And while the videos play, researchers are watching Lucy. Using specialized hidden cameras, they're tracking her eye movement, looking for signs of autism. In the group of children who were later diagnosed with autism, the researchers were able to see a measurable decline in attention spans within the first 2 months of their lives. Autism is usually diagnosed between 4 and 5 years of age, which is why Jones says this new screening process could prove to be a game changer. Warren Jones and his team are now conducting a broader study in an attempt to fine-tune their screening tool. He says this technology will one day give doctors a head start on diagnosing and managing autism, early enough to make a difference.
And from this eye tracking, they study about the percent of fixation of eye in infants. The blue line on this graph is for the typical babies start from 2 months to 24 months, and this identify the typical movement of the eye when they saw the pupil fusions movement. And this the red line. This line from baby with autism, and they study from 2 months to 24 months, and they found at 6 months they have cut point from typical child and children with autism. So this technology can be leading to early to diagnosis autism in the future. And the third one is very important also, is about the brain spatial MRIs, brain scan. It can show some very early signs in autism, and this research team from multi-center in US and have detected the change of the brain organization in infant at risk, which is develop autism at very early as like 6 months of age. Let's see this video.
This special type of MRI scan shows the development of 15 different circuits in the brain. More developed nerve connections are in red, less developed in blue. The pattern is significantly different in infants with autism.
This study, they have participants with 92 infants which aged 6 months to 2 years with high risk. They have sibling with autism, older sibling with autism. And they found that 28 was diagnosed with, in about 2 years old, was diagnosed as autism. And they found these 28 have different connectivity tract in the brain. They have 12 tract in 15 tract, that difference from typical child. So, from these 3 studies that provide detection before the emergence of behavioral symptoms, so in the future, we hope that the brain imaging, maybe the biological marker, that can be very early signs of ASD. And for about the evidence base that we use for, right now we use for diagnostic tools. There's several international standard tools that certifies ICD-10 and DSM-5. For example, that standardized tools for international is the ADOS, the ADAR, and in Thailand, we still use this tool in the research, especially at the ICD. We have the special clinic, the ADOS, for diagnostics autism. But the challenge in Thailand, including because of the ADOS was import, so it's cultural difference, and when we use this tool, it's very costly. And it takes time consuming about 2 or 3 hours when starting to finish scoring. So the third one is identification of ASD be performed by the physicians specialized in child and adolescent psychiatry, pediatricians, and general psychiatrists. But in Thailand, it has very serious shortage of physicians, especially psychiatrists and child adolescent psychiatrists. So that's why our team research, and according to the this diagram, according to the Thai child development system in Thailand, That earlier, Dr. Dutsi introduced about the tools that we use in each level of development. You see in this level, when we use in each level of hospital, the secondary and tertiary level, we have some of delayed development children that have, especially in expressive language, receptive language, and personal social. And this group should suspect autism too. So we have to find tools for the diagnosis or verify this diagnosis as autism from the other disabilities here. So our team research from ICD tried to develop the tools called Thai Diagnostics Autism Scales. We call it TEACCH. And this was granted by Health System Research Institutes under the National Research Council of Thailand. This grant during the years 16 to 18. And this research process have 3 phases. The first phase, we develop the tools. The second phase, we find the efficiencies of these tools. And the third phase, we do on the effectiveness in the secondary and tertiary hospital in Thailand, in every part of Thailand. And character of this tool is evidence-based diagnostic, have a method in the semi-structured test, and for very early in childhood, from 12 months to 48 months. This have 2 components. Of the first one is behavior observation. The second one is caregiver interview. And this can administer by multidisciplinary team in the second and tertiary hospital level, including child, adolescent psychiatrists, developmental behavioral pediatricians and psychiatrists, and nurse, occupational therapists, speech therapists, and psychologists. And this example of the TEACCH kit, they have the manual for how to use this test and the toy books, and all of the instrument is toy. And this is a picture of the TEACCH evaluation. We have observation, and we have the interview the parents part. And based on the prevalence of autism in Thailand, it's estimated right now, about 60,000 children that age from 1 to 4 years that suspected autism right now. So with the number of physicians that qualify to diagnose the ASD is about 110. So we calculate the review, it would take more 10 years to can receive formal diagnosis all in 10 years. But if we have these two and use these two throughout the country, we can be administered by one of the 580 multidisciplinary professional. And it could be complete in 2 years. That's shortened like 5 times. And back to this question, when we screen, when we obtain the early diagnosis. So the very important thing for the better prognosis is early intensive behavior intervention for ASD. The very important theory that very have important role about the early intervention is the theory of early brain plasticity. And this study, the reader is Geraldine Dawson. She's from UNC in the state. And this group of research, they say that intervention in early childhood may help to develop the brain compensation by rewiring to work around the trouble spot and early intensive intervention can change the brain function and organization and abnormal behavior to be similar to typical children. And this can measure by the brain function and organization, that was measured by the ERPS, fMRI, and MRSI, and also EEG. And for the intervention that American Academy of Pediatrics, the AAP, recommend is very early, can early give intervention for kids like 18 months to 72 months, and should have the comprehensive and intensive intervention. And how is intensive is, at least it should have like 25 hours per week, and early age for intervention is 18 months to 72 months, or as early as when diagnosed. And the ratio of teacher and children is 1:1 or 1:2. And should use multi-strategic approach. And the other very important things is parent training too. So this early intensive therapy or intervention will improve in cognitive function, social communication, and also the adaptive behavior. We have the research that our team in RCD do this research right about 5 years ago. We studied on the effect of early intensive intervention program on IQ outcome in children with autism. The participant is 52 children with autism. And the first group had the intensive intervention. Number is 24 in this group, and they got 25 hours per week in continually for 20 months. And another groups have non-intensive intervention. That number is 28, and they got the 10 hours per week for continue for 20 months or so. And we follow up is about 4 years. That at that age of kid, most our average about 6 to 7 years old, which they can do the IQ test, and we use the KABC test to do the IQ test for these two groups. And we found that very interesting here is IQ from intensive intervention group is average is 101. The mean IQ from the non-intensive group is average is 85. So we will see that early intensive intervention can reach the IQ to almost average, like typical child, which is like 90 to 109. This is average IQ for typical child. So earlier that Dr. Dusi, director of RICD, she introduced and presented some services from our institute. And in our institute have early intervention for kids with autism. I will show you some. We have two parts of services, the mainstream treatment part and the alternative treatment part. Our team, including, we have an early intensive program in IPD, inpatient ward, and we have occupational therapists and speech therapists, psychologists, special education teacher in the hospital. And also we have the special clinic, AAC clinic for the complex communication needs kids. And also we use the program, the PECS program and the TEACCH program as well. And for the alternative treatment, it's about the art therapy, music therapy, acupuncture, and HEG, hippotherapy, and training center. We have vocational training. I will show you because earlier you will see some of the services that we have in RICD. This inpatient ward, we will see the early intensive intervention in IPD, and the very important thing that I told you, that you will see our parents or caregiver should sit together with students. It's like the school for kids and for parents who they're training together. So kids will benefit from parents when have some knowledge and know how to promote their kids about the developmental. This is very important and made us success of make the progress of the developmental for their kid. And this in occupational therapy room, we have the sensory integration and room for motor planning activities. We have the snow sled room, and this speech unit at the speech therapy unit. They improve about the articulation and expand utterance and pragmatic function. We have a special education, so this is very different from the hospital that have special teacher in the hospital. They are prepared about the individual education program for kids. And this AAC clinic for complex communication needs. We have from cerebral palsy, we have autism that have problem with complex communication. And these kids use the picture in the PECS clinic. And this TEACCH program for early age of autism when they prepare to go to school. And we have art therapy, hydrotherapy, and also acupuncture clinic, hemoencephalography clinic, and this music therapy, drama therapy, hippotherapy, and the training about the occupational training in our hospital. That the fourth floor we have like services of like hotel stay and kitchen, right, restaurant on the fourth floor, and practice kit at that services too. Is have some like vocational training. This training center on the first floor. So I hope that on Saturday I very welcome and look forward to you all to visit in RICD. Thank you very much.